Deltaven with fast flash technology is a closed-system IV catheter with integrated passive safety device designed to minimize blood exposure and reduce accidental needle stick injury. The Deltaven with fast flash technology is available in a full range of sizes from 26 to 16 gauge in a variety of lengths. Gauge sizes 24 and larger are rated for pressure injection up to 325 psi. Deltaven is also available in a variety of configurations to meet your patient needs, including the single port with stopcock, single port with stopcock and needle-free connector, dual port with dual end caps, and dual port with needleless connectors, which feature a neutral displacement. Let's start with a brief overview of the Deltaven product. It consists of a V-point needle with notch technology known as fast flash, radiopack polyurethane catheter tubing, anti-kinking and softening in vein, winged stabilization platform, color-coded per gauge, soft and grooved to allow air passage, a large push-off tab for easy insertion, a passive safety system, ribbed housing, secondary flash chamber, integrated extension tubing, pinch clamp, both dual port and single port configurations, air vent connection to allow flashback and blood containment, luer lock and cap. Depending on your configuration, you may also have needle-free connectors or stopcock. Placement. Maintain aseptic technique with catheter insertion. Apply a tourniquet as needed and identify vein for insertion. Cleanse the insertion site per your facility's policy. Check to ensure connections are secured correctly. Check the clamp is open. Remove the sheath. Perform the venipuncture using an appropriate angle of insertion. Check for flashback of blood in the distal tip of the catheter. Observe for flash in the secondary chamber. Once flash occurs, lower the device angle to almost parallel to skin. Advance the whole catheter forward a few millimeters to ensure the catheter tip and not just the needle tip is in the vein. Using the large push-off tab, advance the catheter off the needle and forward into the patient's vessel. The grip pads should remain stationary. Stabilize the device by using your non-dominant hand to secure the wings, or use your index finger on the smaller push tab on the catheter hub. Then pull back on the grip pads to retract the needle in a continuous movement, keeping the needle aligned with the catheter body. An audible click indicates the safety has been activated. Observe blood filling the extension tubing, indicating patency. Dispose of the safety needle in a suitable sharps container. Apply IV dressing per institutional policy. Close the clamp. Remove the two-piece band plug and cap from the system. Disengage the clamp and flush all ports using a pulsatile flush to encourage line clearance. Close the clamp. Replace with either a needle-free connector, IV line, or end cap. Disengage the clamp. The Deltaven is now prepared to begin infusion as required.